Monica is a registered nurse, wife, and mother from Louisiana.
Well, I live in Alexandria, Louisiana. I have a husband and 4 children, 4 very active boys. I have 3 dogs outside, 1 inside. I have chickens, cats. It's a little small farm. It's a lot to keep up with the house and the property. We have 10 acres here. So it's constant mowing and bush hogging and weed eating.
Due to a serious car accident, Monica was left with neck pain, loss of mobility, and numbness in her fingers for over 20 years.
I had a car accident whenever I was 20 years old. Went through the windshield. It ended up that I had fractured my entire cervical vertebrae. It began as just neck pain. It started on the right side of my neck, went down into my right shoulder, down my right arm, and all the way into the first 3 fingers on my right hand. I was told in the emergency room at the time of the car accident that I would have pain. So I really didn't think a lot of it, and I was trying to deal with it because I was supposed to have pain.
The pain eventually worsened to the point it affected her ability to work, sleep, and enjoy time with her family.
I'm a nurse, a registered nurse, and I was having to give a lot of IV push medications. And of course, your primary tools for that are these first 3 fingers, which I couldn't feel. They were numb and they would tingle a lot. And then, of course, I had pain in my neck and my shoulder. You would think at night laying down that the pain would ease, but it actually was worse lying down. I wasn't sleeping well. Pain keeps your body at a heightened level, so you feel tired all the time. When you're tired, you're easily frustrated, you're grouchy, and having 4 kids, they're always needing something from you. So I guess I was very short with them, angry a lot. Not the most pleasant mother I could have been. I didn't want to sit down and visit with my children because I was constantly having to put heat and massage therapy and everything on my neck. My husband had bought me the little massage and neck pillow with the heat in it. So when I would get in from work, I would sit on the couch and do that and try to meditate and zone out. I just wanted to be by myself because I was in such pain. And of course, when I would lay down at night, the pain would be worse actually. So I didn't want to love on my husband. I was getting to where I was clumsy. I was dropping things. Like I said, I couldn't feel those first 3 fingers at all. I took a lot of Motrin. I couldn't take narcotics being a nurse and trying to go to work. I did do some physical therapy. And of course, the therapist was able to show me some exercises to do at home that would ease the pain. Went to my regular primary physician, and of course he started over with x-rays and everything, and talked to him about injections, which I didn't feel comfortable with, so I chose not to do that. So he recommended that I see a surgeon for a neck fusion surgery.
Not wanting to undergo traditional open back surgery, she started asking around about alternative procedures. That's when a friend recommended the Bonati Spine Institute.
Some friends of ours had had surgery there and was a success. So we decided to Google it, and right away there was a questionnaire. We filled it out. The process on the website was very simple. Being able to mail in the MRI results was awesome because we didn't have to travel twice to go see the doctor and do a consultation and then plan surgery and come back. We sent everything in ahead of time, so it was planned when we went to do surgery, and we were prepared to stay and do what we needed to do. Of course, the pain on the way there was miserable. I couldn't turn my head at all to the right without pain. The left was limited because of the muscle spasms in the right side of my neck.
Upon arriving at the Bonati Spine Institute, Monica received a physical exam, updated MRIs at the on-campus imaging center, and met with Dr. Bonati to discuss her customized surgical plan.
When we went to the Bonati for our initial examination, we had brought our MRIs over there already. They repeated them there and had everything set up for Dr. Bonati when he came in to look at them. And he introduced himself. And he said, "Don't tell me anything about your pain. let me just examine the scans first. And after he looked at the scans for just a few minutes, he was able to tell me exactly where my pain was, that it started in my neck, went down my shoulder, and affected my first 3 fingers, either on the right or the left side. And I said, correct, it was the right side. Yes, sir, that's exactly how it was. It was amazing. It was very comforting that he knew exactly where my problems were without me having to tell him. Immediately, he was concerned about me and my pain and what I needed. It wasn't about his scheduling for the surgery. It was about what was best for us. He was truly compassionate, and he was like a godsend to us.
The exclusive Bonati Spine procedures are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon to ensure the source of their pain is eliminated before they leave the operating table.
I was at Bonati for around a week. I did 3 different procedures. From the beginning, arriving at the Bonati Institute for the day of surgery, it was very comfortable. And then when they took me into the actual surgery suite, I was awake for the procedure. He would ask me questions as he was doing the surgery. Could I feel this? Could I feel that? And he told me ahead of time that he would have me awake because I would need to answer those questions that would help him during the surgery. And he told me that when he got the bone area shaved down enough that it relieved the pressure on the spinal cord, it would be instant. And I needed to tell him when that occurred. And it was instant. It was like a light switch. I spent years in pain and didn't know that I could be without pain. So it was incredible when it was gone. I could also feel my fingers. Of course, that took, it was better and better as time went by. I guess because the nerve had been, compressed for a while. It needed to regenerate a little bit. So immediately I was able to do what I wanted to do and the pain was gone. Oh, the ride home was smooth. Oh, it made my job much easier because I could feel the syringes again whenever I was pushing the medicine. I didn't have to constantly look at it and worry if I was pushing too fast or too slow. So my job was much easier with the return of the feeling in my fingers.
Monica highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
For the person having surgery that might be considering the Bonati Institute, I would tell them that they're very informative, they're very professional, and they make you feel comfortable. And it's worth it for you and for your comfort level and to get rid of the pain that you're living with, to at least go for a consultation. It's been 1.5 years since my surgery, and of course now I feel like a 20-year-old again. I'm able to do anything that I want. I have no pain. I have no loss of motion. I have full range of motion in my neck, my arm. I'm able to feel my fingers again.
Now pain-free, Monica is enjoying work again and spending time with her family.
My small son does football, and it's pretty much 6 days a week. We practice, and then there's games on Saturday. And it's several hours at a time that we're sitting on the bleachers. And of course, if anybody's ever been to a football game, the bleachers are not the most comfortable thing. But I have no problem with any of that now. They have their mom back too. Like my husband said, he has his wife back. And I certainly feel better. So I'm able to do more and enjoy them more.